you an update and context for our work here in Oregon. First and foremost, I want to remind you that Oregon's Health Insurance Exchange, Cover Oregon, as well as the transformational delivery system changes that we're doing through our coordinated care organizations, were established with broad bipartisan support. This has never been a political football in Oregon. Giving people access to medical care has never been a political football, and we're not going to let it become one. Our objective is to provide health insurance coverage for around 200,000 Oregonians who qualify for the expansion on the Medicaid program authorized by the Affordable Care Act, and perhaps up to 200,000 individuals who don't qualify for Medicaid but wish to be enrolled in a qualified plan through the exchange. Now, obviously, we're having some technical difficulties with the website, and I think legitimately people have asked who is accountable for that. Let me rephrase that a bit. What we should be accountable for is making sure that on January 1st, everyone in Oregon who wants to be enrolled in a qualified plan is in fact enrolled. I'm willing to be accountable for that. I believe that everybody on our team is willing to be accountable for that. The Health Insurance Exchange is a means to an end, not an end in itself. It is a way to facilitate enrollment. Now, about the technical issues we're having with the website, these should not be a surprise. Anytime a large software system is rolled out, there are inevitably glitches. In the private sector, most of those glitches are worked out before it goes on market. Here I have my iPhone, which my son upgraded, helped me by upgrading to the iOS 7 operating system, and I lost my calendar for 2 days, and I'm still having problems with my text messages. So the fact that we have technical difficulties with a big software system should not come as a surprise. We're working on those. The challenge is that we're operating under a short time frame because enrollment starts on January 1st. So we're working on those problems. I'm confident that they will be fixed. But here's the important point. We're not going to let the problems with the website interfere with our objective of making sure that every Oregonian who wants to be enrolled with a qualified plan by January 1st is in fact enrolled. And here's how we're going to do it. We have hired up to 100 individuals with resources that Cover Oregon has for its enrollment budget to essentially begin to accept and process paper applications. This morning, I directed staff at the Department of Administrative Services, the Oregon Health Authority, and the Insurance Division to supplement that so that we have the workforce necessary to continue this enrollment process as long as we need to until we get the technical difficulties worked out with the website. Now, secondly, there are a lot of people in Oregon who don't need to go through the exchange to have their eligibility determined. These are people who are already qualified for the Oregon Health Plan, who are getting SNAP, federal food stamps, or people who have children on the OHP. We can enroll them directly. We've got 70,000 people already going through that process. We expect to have 100,000 by January 1st. And it's very important that they take advantage of that fast-track process. We've got this to away with the federal government, because that frees up capacity in our workforce to focus on two groups. The first group are the approximately 100,000 people who are currently in Oregon's high-risk pool, the Oregon Medical Insurance Program. Because we no longer allow discrimination based on pre-existing medical conditions, which these people have, that the OMEP, the high insurance pool, is going to go away. So we're focusing to make sure that we get all those people covered and enrolled before that happens. The second group are the approximately 200,000 people who could become enrolled on a qualified health plan through the exchange but aren't eligible for the Medicaid program, and we're working basically to ensure that we have the horsepower to make sure that all of those people who want to have a plan by January 1st will have one. So again, our commitment is to ensure that everyone who wants to be enrolled in a qualified plan is enrolled on a qualified plan by January 1st. All the pieces are in place to make that happen. We're just deploying them a little bit differently now than we would have had the exchange, had the website been up and working a few weeks ago. Our health insurance companies are ready. Their new benefit packages are competitive. The online application form is ready. People should fill it out online, print it, and send it to us. And Liz Baxter, the chair of the Cover Oregon Board, will talk a little bit more about that. Our local community assisters and local insurance agents are ready to help answer people's questions about whether they are eligible and what kind of financial benefits that they might receive. I also think it's important to recognize that insurance coverage is just a step to access And in Oregon, we're moving towards a delivery system that moves away from after-the-fact acute care and focuses more on prevention and wellness and community-based management of chronic conditions. In other words, giving people better health at a lower cost with better health outcomes. That's the other piece of this that most states don't enjoy. So let me just say again that we believe that we're still on track. We will get the job done. We are going to make this work. At some point, we'll get those glitches with the website done, and we'll be able to back off this current workforce, and it'll obviously be essential as we enroll a significant number of people over the next year to make Oregon hopefully one of the states with one of the lowest rates of uninsurance in the country.
Governor, if you start processing these applications manually, these paper applications, how do you plan to do that in a time-effective manner? So far, there are, I think, 6,000 applications. Is that possible to get done in time?
Yes, and I can have Bruce talk a little bit more about that. Very conservatively, you can process 6 applications a day. So if you have 100 people, that's 6,000 a day. You can do the math. And we're supplementing that, as I said, with other personnel. So it takes longer, yes. But we are not going to have any of the problems that Washington had, essentially giving people subsidies that they weren't eligible for.
You think that the website, I'm just reading through here, I saw it has like 1,700, a very complicated system, like 1,700 items. Is it too complex? Some of the other states only have a couple of hundred.
Yeah, I mean, you know, I guess one could argue in retrospect we bit off more than other states, but it was an intentional decision. I mean, we've got a single portal for Medicaid and for the people who are coming in that are not Medicaid eligible. And once we work out these difficulties, I think people in Oregon will be really ahead of the pack. It gives you the ability to crosswalk with people who might be eligible for the SNAP program. You know, it is a complex system. But I think once we get through this initial sort of rollout phase, it's going to be a real asset for us.
And what is the status of the website right now?
Okay, I'll be happy to answer a few more questions later. Let me just bring Liz up and Bruce, and then we can just open it back up.
Okay.
Highly emotional.
So I'm Liz Baxter, and I am the chair of the board for Cover Oregon. And we know that many Oregonians have been really frustrated with how the system has not been able to come up fully online. I just want you to know that we are frustrated too, and people are working day and night to fix those technology challenges. In the meantime, Cover Oregon does have a system in place to enroll people using paper applications, especially those who want to have coverage by January 1st. So the paper applications are available via the website. They actually are a PDF that have fillable enrollment spots. You can submit it online. People can download the application and print it out, fill it out, send it by mail. Community partners and certified agents have copies of those applications. But the important piece to know is that Cover Oregon is accepting applications today and will continue to do so. So while the technology stuff has gotten the most attention, it's just really important, and this echoes the governor's remarks, that Cover Oregon is more than a website. That really this is about getting people access to health insurance coverage options that they were not able to have access to before. And so for us, connecting people to those coverage options is what is important, not as important to us how they sign up for that. And I know the focus has really been on that. So since the 1st of October, Cover Oregon has had more than 570,000 visits to the website. Those are unique visitors. More than 26,000 calls to the hotline. And more than 17,000 people have already enrolled for coverage, applied for coverage. So we're processing all of those applications today. And as the governor mentioned, resources have been dedicated to make sure that we get all of that work done. So if I wanted to figure out what should I encourage Oregonians to do, the first thing that I would say is to apply. My biggest concern that all of the media coverage is kind of making people not apply. We need them to apply for coverage and do so as soon as possible. There is a shorter version of the application for Oregonians who are not looking to ask for tax credits and any subsidy assistance. And Bruce will talk about the fast track application. I think that will really help folks kind of streamline that process. The second thing that Oregonians can do is they can actually choose their plan now. So the things that the website is able to do, people can compare plans, select the one that they might want to choose for themselves to enroll in. They can get estimates about the tax credits. They can check their eligibility for the Oregon Health Plan. They can figure out what that monthly premium quote might look like. They can find out which plans cover their doctors and many other things. So the fact that they can't actually do the final enrollment online doesn't mean that there's not a lot of other information that will help them make the choices they want to make. So 855-COVER-OR. You can call that number, you can ask anything. You can ask about enrollment, you can ask about any of the information about Cover Oregon, and it gives you access to help in multiple languages. Really important for that. And just a final reminder that all of that assistance through community partners, through the insurance agents, and through our call center, those are all things where there's no additional cost to anybody to get that help. So enrollment is open through the end of March. It is really important for folks to understand December 15th, that is the deadline for anybody who wants their coverage to start on January 1st. What we've made a commitment, we're going to do everything possible to make sure that anybody who applies by December 15th, that their coverage does indeed start on January 1st. So I want to personally thank folks for their patience, even if you don't feel like you've been very patient. We know that there are many Oregonians who've been waiting months and sometimes years to get access to affordable coverage that will work for them. So on behalf of Cover Oregon, of the board and the staff, we are committed to making sure that Oregonians get access to that coverage, that it works within their own individual budgets, and we are indeed going to get all of these technology challenges fixed. Thank you.
Good morning, Bruce Goldberg. I'm the Director of the Oregon Health Authority, and I'm here to tell you about the fast track option, which has been alluded to. This has been something that we at the Oregon Health Authority have been working on as we look to get ready for 2014. We realized that it was likely that many of the people that were now going to be newly eligible for the Oregon Health Plan have already been through another federal program. Namely two, that they've been either through SNAP or they have kids in the Healthy Kids program. What that in essence means is that they've pre-qualified. They've been enrolled in a federal program, they've filled out an application, they've had their income verified, they've been enrolled in essence, and so now there was no reason for them to have to again fill out a long application and duplicate that administrative burden. We applied to the federal government for a waiver, and the feds agreed that this was a logical opportunity to enroll people in coverage. A handful of other states were also looking at this. And so now to get enrolled in the Oregon Health Plan, we identified approximately 260,000 individuals who were either already enrolled in the SNAP program or had kids in the Healthy Kids program and whose income qualified them for enrollment in the Oregon Health Plan. Those individuals got a letter. It looks very much like this. It's a simple one-page form, and all individuals need to do is answer a couple of questions, say that they would like to enroll us in the Oregon Health Plan, send it back, or they can call an 800 number, 800-699-9075, and they can get enrolled in the Oregon Health Plan. Community assisters through Cover Oregon are also working to help get the word out to people. We hope you'll help get the word out to individuals today. The word is really simply this. It's a couple words. It's send the fast track back. If people could just send the fast track back, it's the easiest way for people to enroll. There are people who have been pre-screened, they're income eligible. There's really four things that qualify someone. Number one, they're an adult. Number two, they've qualified for the Oregon Health Plan by their income and their residency in the state. The income qualifications are an individual whose yearly income is $15,800 or lower. If you're a family of two, it's $21,400 or lower. So you've qualified by income, you're an adult, you're receiving food or health care benefits already, SNAP, or your kids are in Healthy Kids. And the last thing is you're not receiving Medicare. That's it. If you meet those criteria, if you've gotten one of these letters, you're qualified. The big issue is to send the fast track back. It's the easiest way for people to be enrolled in coverage starting January 1. It will keep people, it will minimize the number of applications that we need to process. It will allow us as a state to really focus on enrolling people in qualified health plans through the exchange. And it means people don't have to fill out a longer application. I think this is a great way that shows how together we're all marshaling our resources so that together we can get as many Oregonians who qualify for coverage covered as of January 1. So with that, I think we'll open it up for questions.